So first is colostomy care. Phase 1, wash hands and apply appropriate soap and gloves. Next, greet and identify the patient. Next, promote privacy if needed or necessary. Next, assess the patient for vital signs and verbalize findings. Next, inform and explain the procedure to the patient and or relevant other. So phase 2, gather and prepare colostomy care supplies in a clean tray. Next, place a towel under the patient's back with half of the towel exposed just adjacent to the colostomy. Next, drain the ostomy bag carefully into the urinal or collecting basin. Next is remove the existing ostomy bag carefully and dispose accordingly to hospital infection control practices and proper disposal procedures. Next is inspect the stoma site for color, size, output, and surrounding skin condition. Next is place the kidney basin just below the stoma while cleaning the stoma using warm water without soap. Clean the peristomal area using water or warm water with non-irritating soap. Next is wet the gauze pads to gently dap the stoma and peristomal area. Next is gently dry the peristomal area with clean tissue paper or dry gauze pads. Next is apply skin barrier product as required or according to hospital guidelines. Next is measure the diameter of the stoma using a stoma measuring device. Next is make a mark on the adhesive part of the flange as to the size of measurement of the stoma. Next is cut and remove the excess adhesive according to the size mark. Next is remove the paper over or cover of the adhesive and held in place around the stoma for 1 to 2 minutes to create an adequate seal. Next is remove the disposed gloves or PPE accordingly. Next is perform hand hygiene. Next, document a procedure and findings according to hospital guidelines and refer to attending physician if needed. So phase 3, explain the steps of colostomy care to the patient. Next is address the patient's concern about stoma appearance and function. Next is provide tips for managing the colostomy, including dietary considerations and recognizing signs of complications.